back in the autumn, back in September time, we told you about a pilot programme in Southampton, which was aiming to test staff and students at 4 schools across the city and at the university for COVID-19. Now, over 16,000 people were registered, and the study has shown, really, that regular testing can play a valuable role in controlling the transmission of the virus when it comes to educational settings. Well, programme lead at the University of Southampton, Professor Keith Godfrey, joins me to chat a little bit more about this. Keith, thank you ever so much for coming onto the programme. We know now more and more people are being tested in various settings, care homes, the NHS, big companies. You were kind of ahead of the curve of this, though, last year. Talk me through what you did, how you were testing people.
Thank you. Well, first of all, we had to develop a test which was much more acceptable to people, and particularly so to children and teenagers. And so what we did was we moved away from the traditional swab test, which is done in the NHS, and we've been testing saliva. And the reason that makes sense is actually the saliva glands in the mouth are the very first tissue in the body that the coronavirus infects. And it's actually quite simple to put a sample of saliva on an ordinary household teaspoon and into a pot for testing in the laboratory. So we've done a lot of work behind the scenes to develop a cheap, reliable and fast test based on saliva. And we've now done over 100,000 tests, and among those we haven't found a single false positive. All our positives have been confirmed by standard testing. And we've also found in a nationwide activity that the test is very effective and sufficiently sensitive to pick up people who are potentially infectious with the virus.
And when we say regular testing, how regular are we talking about here?
So the programme which we've completed now with the 4 Aspire Community Trust schools was based on weekly testing, with the proviso that for some groups we did twice weekly when they were coming back from half-term holiday, just to make sure that there was no transmission. And indeed, within the school setting, we managed to help there to be no transmission between pupils and staff or vice versa.
And just sort of talk me through then the other findings, apart from the fact that the accuracy is pretty strong. What are your recommendations as a result of the study that you conducted?
What we found was really important was engagement with the students and the teaching staff to not just say, here's a test, do it, but to explain the science and all the wraparound around coronavirus, because there is so much misinformation out there that students really need to have a better feel for what is trusted information and what isn't. And in fact, the students really did engage with that, and they had confidence that came from the tests that allowed them to come to school at times when they might otherwise have been hesitant. And school attendance rates actually increased even at the height of the second wave back in November to 94% in the schools that we were testing. For parents too, and for staff, it was an enormous confidence builder, and it reduced staff sickness rates in the schools.
So, Keith, moving forward then, how is this information going to be used? Because, I mean, at the end of last year, the government was saying that it wanted testing in all schools from January. Then, of course, all the lockdown was announced and schools only ended up returning for a day. Is the plan that this is going to be rolled out nationally once we come out of the national lockdown?
So we've had to do a lot of development to increase the capacity for this type of testing, and plans are near completion to roll out the next phase of saliva testing, which aims to increase testing in the community in a range of education, health and social care settings, initially in Hampshire and Isle of Wight region as a pathfinder for a national activity, and this is now being led by University Hospital Southampton as the NHS Trust, working across local government and with primary care, etc.
My goodness, some really strong work. Keith, really fascinating to talk to you. Thank you so much for your time this afternoon. Professor Keith Godfrey, who's Programme Lead at the University of Southampton.